Three, two, one. Welcome back to another episode of AT Talks for our topic 3, National Athletic Training Month. So today we have two guests. We have Alyssa and we have Natasha. Whoever wants to go first, just quickly introduce yourself, say your name, where you're employed, the setting, the state, how many years of experience, whatever you'd like. But the floor is open.
My name's Alyssa Bannerman. I have been a certified athletic trainer since 2018. Right now, I'm currently working in the collegiate setting at a D2 university out here in California.
Awesome. I'll go. I'm also from California. My name is Natasha Denmark, and I currently have a couple of settings. I actually work in corporate. I do corporate education, so I create curriculum for healthcare companies. And I get to work from home, and I also work at a community college in Whittier near Los Angeles, and I teach introduction to athletic training classes there. Oh, and I've been certified since 2007, so going on 13 years.
Awesome.
I don't know if you listen to any of the other videos, but my name's Tom. I'm an athletic trainer for East Chicago Central High School. That's in East Chicago, Indiana. Probably about 1,000 kids, 200 of those are athletes. But I was certified in 2016. So is there any plans you guys have for National Athletic Training Month?
Not so much really big plans, but I know me and my fellow colleagues, we make it a point upon ourselves to really educate our athletes on what we do, because I know that there's a lot of athletes that aren't in the kinesiology realm who really just think we hand out water and tape ankles when they're hurt. So it's a really good opportunity to kind of strike up a conversation in between treatment, like, hey, what is athletic training month? That's National Athletic Training Month, and what is the profession? And we get to give them cool facts that help relate. Like, we do have a Hall of Fame for athletic training, and then they're like, what? I didn't know you can really make it as an athletic trainer. I said, yeah, like we're really branching out, and I get to educate them in that way, which is also super cool.
Awesome. I love that. I try to educate everyone. I mean, I work with healthcare, so nobody really knows what an athletic trainer is at all. So they're like, well, what's your background? And so I try to educate them on that and what it is and how I got here. I work with a lot of physicians and pharmacists, so I'm like, hey, we're right here on the same map with you guys. So educating them and giving them that knowledge. For me, also, I just finished my doctoral studies last May, and my dissertation was in how to include cultural competence or cultural content into our educational programs, so our ATP programs, and how to include those things like through the actual assignments that they get, through the actual projects that they create. So I graduated from Cal State Northridge, and I worked with Cal State Northridge programs, the students, the ATP students there and everything. So it was a lot of fun, and just advocating for cultural competence, which I'm actually working with people to change. So if you guys have any ideas, but competence means that you already know the information, you're already competent in it. So for me, my study was really based on cultural humility. And what that means is, basically, hey, this is what I do know, this is what I don't know. So I have room to grow, I have room to understand, room to learn what different backgrounds our athletes come from, our students, whoever, our patients, whoever we serve. So that's a big thing that I like to advocate for every day, but especially during National Athletic Training Month, because it's one of our competencies, but it's not something that necessarily everyone is in tune with or goes out to study. So
yeah, absolutely. I love that point that you kind of made about competency. And I think a big thing, not just in athletic training, but just in society as general, we don't want to say we don't know something. We don't want to say we're
Mhm.
bad at something,
Right.
but just admitting it is a step towards growth. So I
Mhm.
think, I think that's great that you're advocating for that. We don't know it all, and there's always room to learn something to improve our skills some way. So even taking that self accountability and saying, you know what, I don't know something, but why don't you teach me? Not
Exactly.
I don't know it. You can't teach an old dog new tricks type of thing. Yeah.
Exactly. Yep. That humility part. So I'm hopefully I can work with EDAC and all of those areas, which I've already started reaching out to get that language kind of change. And I know it's part of our competencies and that's why it has that language, but at least to include in there something about, hey, it doesn't mean that we know everything. It just means that we're on our way. We have a
Yeah,
pathway to learning. So.
absolutely.
Do either of you two have any fun or unique ideas that you like to do to advocate besides just word of mouth talking?
I think the cool thing that and we're all pretty big on social media in the AC world. Yes, I know. I'm like, Twitter is awesome, but I think it's really cool that we are seeing athletic trainers use these current media to advocate, and then we can also, connect with the population that we're working with, and I know my kids are always on Twitter, so, advocating like what is an athletic trainer, what we really do, the kind of controversial things that are going on in our profession, you know. I think it's really important that we stay, on or up to date with what is hip, and with the best way, to get the message across. And the cool thing is like we've all been different parts of the world, but here we are right now because of technology. And I think that's really huge that we use that to continue to push the profession.
Definitely. I agree with that. I feel like I see everyone's Twitter posts, which is my favorite form of social media. Um, I also think, and I know they have different grants and different scholarships available through the NATA. But for me, just researching and getting those grants to kind of to have online platforms. So similar to these types of conversations, but having, virtual classrooms in a sense to get folks that can't maybe go to the convention to come in and participate online. And get CEUs for it. So things like that, just, again, like Alyssa said, using technology to kind of leverage that education and get it out there to everyone. And I mean, we have a pretty good, right now with NATA, the professional center is really good, professional development center. I get most of my CEUs from there. So I think just continue to building on that and making sure that everyone is aware that these opportunities are out there and just having these conversations. Because I do think that, and I feel like from the last couple of sessions that you've had, Tom, the conversations about burnout and things like that, because there is those types of things, I feel like a lot of athletic trainers don't even get to do the professional development that they want. Like it's a lot of the time it is last minute or where they can fit it in. So I think getting to the root of the issue of, how do you manage your time? How do you manage your professional time working with your patients, working whatever setting you're working at, and also continuously learning and making learning a priority. So I think that's important and definitely topics that need to be explored and shared during National Athletic Training Month so that everyone is, because everyone's like so gung-ho. So I think it's things that don't get talked about should get talked about during that time.
Yeah, I think that's one of the nicest thing about National Athletic Training Month is that there's the same X amount of people that advocate a lot on Twitter, but when it's National Athletic Training Month, everybody's out there. Yeah, yeah, yeah.
Exactly.
And what I've started to do over the last several months is instead of just advocating to athletic trainers, I've been trying to follow a lot of strength coaches, a lot of PTs, a lot of sports coaches. I tried following some nurses, but they didn't want to follow me back. but just to expand, because I think a lot of the time we have a lot of people we talk to on Twitter, but it's just an athletic trainer to an athletic trainer. So trying to get outside that bubble.
Yeah, definitely. And we work in a really unique setting where we do have a lot of overlap with other medical professionals. So why not use this month to bridge that gap and, say, hey, we might not do the exact same thing, but, we're touching the same patient, trying to make a difference. So why don't we make a difference all together?
Yeah, exactly. And I think another thing, and I don't know about your fellow alumni from your programs. I know that from my program, there's several that either went into physical therapy or OT or other fields. And so part of what I know my old program does and what I try to do with them is get all of these folks in contact. And, especially in California, we have a struggle with all of the physical therapists. So getting them in and getting them to advocate, and they, a lot of them do, they advocate on the athletic trainer's behalf. So just kind of getting those alumni and figuring out who does what and how we can leverage all of the different careers that we're in or settings that we're in to really spread the word and advocate, because we need some licensure here, guys.
I know. And I think that is such an important thing that we touch on too in Athletic Training Month, especially obviously for all athletic trainers, but the ones that are in California, we really do need to bring awareness to the fact we don't have certification or licensure out here. And what better month than our month to really bring light on that. When I tell my athletes, this is the only state of all 50 that you don't need a licensure or certification. When I was like, so if you want a job as an athletic trainer, at the employer's discretion, they can say sure, and then they're like, I don't know CPR, I don't know. That's going to say exactly. That's what's scary, and it happens here in California more than and it's disturbing, and it really should be talked about, and it should upset people so we can get that push to get licensure and to get certification that we need.
Exactly.
And I think that's one of the really nice things about social media is that everybody, there's a lot of people that don't know, and then using social media, you can reach out and grab people like me in Indiana, the people in Vermont or Michigan, New York, all over the place, and then we can hopefully come together and try to push those through. I know there's a couple people that have tagged me in various things like, hey, we need you to sign this off for the New York licensure bill or the California bill, and you go on there and you just put some information in and it's done. But is there anything else we want to cover for National Athletic Training Month, or do we feel like we hit everything?
I think we hit a good amount of topics. Yeah.
All right. Well, I appreciate you.
Too.
I appreciate both of you spending your time, and I would like to have you back for future topics, future discussions. I don't know what those future topics are, but we'll find out eventually. But thank you for your time today, and I hope you have a great rest of your week. Have a good weekend.
Yeah.
Awesome. You too. Thanks.
Yeah.
Yep. Thanks for putting it together.
Absolutely.